Being dependent on drugs or alcohol can be scary, it can be confusing. It doesn't have to be, though. The folks at Cottonwood Springs in Olathe have an entire unit dedicated to helping people out with addictions, and Dr. David Willey is the new director for the Substance Use Disorders Unit, or SUD unit. Dr. Willey, I want to start with your background because you are board certified, you graduated from medical school, but you're also a recovering addict.
That's correct.
So you know 100% what people are going through.
I do. I didn't initially choose this field. It kind of chose me, if you would say. So initially in my training 14 years ago, I was a different type of physician. I was in residency as an anesthesiology trainee and developed an opiate addiction. Luckily, there were people there, including a loving family, employers, and people who now do what I'm doing there to get me the support I need and got me to the treatment that I need.
You've walked the walk. You know what people are going through when they enter your facility.
I do, and I think that helps develop a relationship with my patients. I've not only been successful in recovery, but I've also suffered life-changing relapses, so I know the challenges of dealing with this problem.
Can you explain to people watching who don't know what exactly is SUD?
Well, SUD stands for substance use disorder. That's kind of a comprehensive name that we put together. That's for substance abuse, substance dependence. Now we know because of partly because of the opiate epidemic that people develop a dependence on medication is only one aspect of it. People can be dependent on pain medications, sleep medications, develop a tolerance to those medications, but that doesn't necessarily make them an addict or a substance use problem. So substance use disorder kind of comprehends a spectrum of substance use problems where people continue to use substances despite the negative consequences from a behavioral standpoint. It's the easy way to.
So if you have someone in your life, maybe it's you watching, how do you know the difference between being dependent on something and being addicted to something, and how would you spot that in a loved one?
Yeah, it's a great question, and I get that all the time, and I guess maybe a simple way to do it, or a simpler way to do it, we kind of say the C's of addiction. Sometimes is there consequences are the big one. What are the consequences of people's continued use? Because this is a devastating problem. Is it compulsive use? Has it progressed from recreational use to compulsive use? Have they tried to cut back and been able to? Are you concerned about their use? And then you look at the consequences in terms of how does it impact their life? It has devastating impacts on their relationships with loved ones, occupationally, spiritually, their physical health, their psychological health. So the warning signs are there, and I think people sometimes see it in their loved ones before they do themselves. And if there's a concern about their use, then you have to ask them. And I think that's a big part of this is screening and getting people ability to, or the opportunity to talk about it.
So as someone who is himself a recovering addict and a doctor, what made Cottonwood Springs attractive to you, and what makes Cottonwood Springs different than other facilities that are out there?
Cottonwoods, we're doing great things, you know, and what we're doing is spreading the word of hope. You know, we got to get that out there, that there's a negative stigma around addiction. There's a negative connotation. This is a moral failure. What people have to understand is this is a chronic progressive brain disease, and some way to think about it is this is a disease of choice in a way. And what we're doing is starting from every aspect, from chemical dependence unit for detox and withdrawal, inpatient rehab for continued care, outpatient services to keep people engaged in our services as long as they can, because what we do know is that the longer people stay in treatment, engaged in treatment, the better, because this is a chronic and progressive disease that needs to be addressed the same as other chronic progressive disease such as hypertension, coronary artery disease, diabetes. You don't treat those things in 28 days or a 5-day detox. They need continuing care. So we start with every aspect from detox all the way to outpatient care. So, you know, when people get to a point of using over and over again, they're not usually they're usually using just to maintain their level of functioning that they do have. People use drugs to either provide a sense of euphoria or a sense of well-being, but more often than not, it's the relief from aversive or negative emotions or consequences such as painful trauma, anxiety, depression, sleep disturbance, pain symptoms. And what we do at Cottonwood is you have to do what we call integrated treatment. You have to address not only the substance use and what they're doing, but what's causing that. What are they doing and what are they masking, or what is the triggers for their use? And if you don't address those underlying issues, their chances of recovery and sustained abstinence from those substances is much less. So what we do is what we call integrated treatment, starting all the way from detox all the way through our partial hospitalization and outpatient program to address both the mental health issues and the substance use issues.
Hopefully people who are suffering this see this segment today and they call, because you do have a 24-hour hotline. Dr. Willey, thank you for being here. Really remarkable story, and congratulations on surviving everything you have, and you're helping so many people.
Thank you.
Cottonwood Springs is located on South Arapahoe Drive in Olathe. If you would like a free 24/7 assessment, just call 913-353-3000 or visit cottonwoodsprings.com. We'll be right back.
For more information,